A very good evening to everyone who have joined the webinar. So we have gathered here for the webinar on snakebite envenomation identification and first aid. So this webinar is organized by Aghanaashini Nature Club, which mainly focuses on educating people towards nature and wildlife. So we have our today's speaker, Dr. Nikhil Paul. He is an emergency physician and assistant professor from the Department of Emergency Medicine at 𝗀𝗃𝗵𝗏 Medical College, Mangalore. He is a founder and director of Outdoor Medics and is also an outdoor enthusiast. So I request Dr. Nikhil Paul sir to take over the session.
Right, good evening all. Ellargu namaskara. I'm Dr. Nikhil Paul. I'm an emergency physician from KMZ Mangalore. I also run a small company, Outdoor Medics. So today's topic is about identification and basic first aid of snake bite and what to do to avoid snake bite deaths. So I know most of these presentations over here is mostly related to nature and ecology and all, but today's topic is a little more into snake bite deaths and first aid. Right. So I try to cover few topics within this presentation, which includes common snakes of Western Ghats, snake ecology and behavior, in short, then symptoms of snake bite, first aid practices, as well as some skills which will save the patient. Every year, about 58,000 Indian citizens die due to snake bites. So there are around 300 snake species in India, of which 62 are identified as venomous as well as mildly venomous. State of Karnataka in recent, there's a recent development in February, declared snake bite deaths as a notifiable disease. So that means all the snake bites has to be reported to the government. They have their own proforma and they have their own records as well. So that is the stress on snake bite which is happening very recently. Let's see the common snakes of Western Ghats. Grossly, we divide it into venomous as well as non-venomous. And venomous snakes, which belongs to three groups, that is the 𝗀𝗵𝗵𝗁, 𝗲𝗵𝗵𝗁, and 𝗀𝗵𝗵𝗁. So your 𝗀𝗵𝗵𝗁 contain all these neurotoxic snakes, that is the snakes which is nerve toxic or which causes nerve weakness or breathing difficulty and all. So with this 𝗀𝗵𝗵𝗁 includes your cobra, your crate, you have some coral snakes as well as some sea snakes. I'm mainly focusing on snakes which are found in Western Ghats as well as the Karnataka part of the Western Ghats. Now you have the 𝗲𝗵𝗵𝗁, which has both typical vipers as well as pit vipers. And 𝗀𝗵𝗵𝗁, there are few snakes semi-venomous. In fact, most of the 𝗀𝗵𝗵𝗁 snakes in Western Ghats are either semi-venomous or mildly venomous or non-venomous. Now, beginning with in the snakes of the 𝗀𝗵𝗵𝗁 group, we have the commonest one, one of the most venomous one. So that is the common spectacled cobra, naja. So how to identify? You have the spectacle, the hood. Behind the hood, you have this spectacle pattern on the hood, and again you have the distinct head as well as usually the ventral color. That is the this side will be white or yellowish. Now we have the king cobra. These are very large snakes, and the basic identification would be an inverted V shape behind the hood, behind the head, in fact, and you can see that these are continuations from the front aspect. The ventral aspect, it just continues towards back. These cannot be missed because these are very large snakes. And next one would be a common crate, very venomous, small but very venomous. So identified by bands all over the body, which are found in pairs. You can see that these bands are found in pairs. The ventral aspect is usually white, and peculiar feature is that you have a single row of hexagonal scales over the dorsum, that is in the center. And this first part of the body, the head and the neck, lacks any bands usually. You also have some banded crate, which is rare compared to the common crate. These has bands all over. Now, other snakes which belong to the Elapidae group are the slender Indian coral snake, which are one of the very smallest venomous snakes in India. Uh, these are venomous, but they are very small. Now, other coral snakes include a bibrone coral snake. These are very beautiful snakes, and also striped coral snake. These are rare compared to all the other snakes, but again venomous. Another coral snake is the Bedom's coral snake. Couple of sea snakes are also found along Western Ghats. So especially towards the coastal region in Karnataka. So we have the blue spotted annulated sea snake, as well as the hook nose sea snake. These are neurotoxic. Again, that means they are toxic to the nerves. Now, next group is the Viperidae, contains two subfamilies. So they are the typical vipers, the Viperae, as well as pit vipers, that is Crotalinae. So vipers, the peculiar feature is thick-bodied. They are short and thick-bodied. They are hemotoxic. That means they are toxic towards the blood, or they cause problems with the blood, clotting of the blood. And they have small rough scales on dorsum of the head. And we have a peculiar feature, that is the triangle-shaped head. And they have characteristic coloring and marking all over the body. Another feature is that they have really long fangs, usually normally folded flat against the upper jaw, and they come in erect shape when they are about to strike. Snakes which belong to the Viperidae include Russell's viper. So Russell's viper you can identify by peculiar diamond-shaped marking all over the body of the snake, usually light to dark brownish gray color, or maybe even a little towards the orange or reddish coloration also. Another snake is the saw-scale viper. They have again the triangle-shaped head, which is peculiar of the Viperidae. They have particular keeled scales all over the body. So they resemble the saw, the teeth of the saw. Again, they have peculiar type of movement, though that is called a side-winding type of movement, which can be easily identified. They can move towards the side. Pit vipers, they have this organ, which is a heat-sensitive organ, or they identify the prey, their food. With the help of this, they have this pit on the just near to the eyes. Different types of pit vipers are found all over Western Ghats, which include a hump-nose pit viper. So they have the peculiar hump shape over the nose around the face, and they also have the pit. Now, Malabar pit viper, they are found in different colors, which ranges from green to yellow to brown. You can see the polymorphism, different colors of Malabar pit viper over here. Large scale pit viper also found in some parts of Western Ghats. You can see the large scales over here on the body. And Some other 𝗡𝗿𝗵s include the bamboo 𝗡𝗿𝗵, which is similar, as well as a horseshoe 𝗡𝗿𝗵. Coming to mildly venomous snakes of Western Ghats include a common cat snake. So we'll focus more on the venomous snake. So other mildly venomous include a common cat snake, an ornate flying snake, which are very beautiful snakes. The green vine snake, which is commonly found everywhere, which has a peculiar facial features, and Gundar's wine snake, as well as a brown wine snake. These are mildly venomous. Now we have a lot of non-venomous snakes. So we have seen that we have more than 600 snakes in India. So a lot of non-venomous snakes are there, which include common wolf snake. These are very similar to crate because they also have bands all over the body, different colors of different shades of common wolf snake. We also have a Travancore wolf snake, which is again darker in complexion. A rat snake found in common households. Sand boa, common sand boa. We have different types of boa, common sand boa, the red sand boa, as well as Whitaker's boa. Now, checkered keelback, which is non-venomous. These are the common non-venomous snakes. We have a Beddown's keelback. Some types of keelbacks include a mountain hill keelback. Now, different types of kukri. Kukris are also found. Here, these are identified by the peculiar V-shaped pattern over the head. Smaller snakes, non-venomous, absolutely non-venomous. Russell's kukris, I say, they also have this V-shaped pattern over the head. Western kukri, they don't have the V shape, but they have another plus-shaped pattern over here. Now, some miscellaneous snakes include a trinket snake, which is very commonly found, absolutely non-venomous. Now, bronzeback is there, tree snake. Now, shield tails are rare, very rare, endangered. So I hope there was a presentation before. There was a topic presented about shield tail snakes as well. They are having beautiful colors over the body. Some Indian rock python. So we have one of the largest snakes in India. That's the rock python. Some minor snakes like Brahmini worm snake or a beaked worm snake. These are a worm kind of snake, as well as some Sicilians are also there, but these are not snakes as well as not worms as well, somewhere in between. They are characterized by ring-shaped folds or annuli on the body. Right. So our focus is, we have a lot of snakes over here, but our main focus will be on these four snakes. So they are called the big four snake. So we have the Russell's viper, the saw-scale viper, the common spectacled cobra, as well as a common crate. Why they are called the big four? Because most of the deaths due to snake bites is by either of these snake. And sadly, we have only one kind of antivenom in the country. That is the treatment for snake bite. That is, which covers only these four snakes. We'll come to that later, but you should understand that these four snakes are the big four snakes. Now, similar snakes, venomous and non-venomous, might create confusion a little bit. So, as I told before, common crate is wolf snake is often mistaken as common crate. The difference is that, like again, wolf snake has a narrower neck, whereas common crate has a wider neck, and the peculiar band shapes. So these are found in pairs in common crate, whereas single in wolf snake. And also the wolf snake has rings at the first part of the body, whereas common crate doesn't have. And also we have the single row of hexagonal scales on the dorsum in the center in case of common crate. A small deviation from that, a juvenile crate, which very much resemble a wolf snake. Here, there is the difference is that the first part of the juvenile crate also has a ring. Now, don't identify a juvenile crate as a lycodon. Russell's viper and common sandboa. So we have seen common sandboa. These are also thick-bodied snake, whereas Russell viper is also. The difference is that you have triangular head in case of uh, Russell's viper, whereas the head is indistinct in case of common sandboa. And uh, here you have the diamond shaped over the body, like you can see the oval or diamond shaped on top of the dorsum, peculiar. Now Russell viper and python. So very recently there was a video in which a man caught a Russell viper thinking that it is a rock python. He was bitten and he was later hospitalized. As far as I know, he succumbed. So Russell viper, a small rock python or a very big Russell viper might look similar. Again, the difference being the head is actually triangular in case of Russell viper. The head is elongated in case of rock python. The scales are again small and keeled. It's whereas here the scales are almost smooth. Again, there is no distinct neck in case of rock python. There is a distinct neck in case of Russell viper. So these are some of the snakes which create confusion. Now, common snake. A few words about the snake behavior. The Indian cobra is diurnal. Most of the venomous snakes in the country are nocturnal. So, but Indian cobra is also diurnal. They are found on the level ground, as well as they are very good climbers. You can see them climbing on top of trees. You can see them climbing on tops of around homes, buildings, the grills. Now, Russell viper is nocturnal. They prefer open, grassy, bushy areas. Saw-scale viper, again nocturnal. They are found in the night. Usually, they come out in the night. They prefer sand, rock, and scrubland. Usually, they hide behind rocks. They have this sizzling sound, as we discussed earlier. Their scales are pointed and they resemble the teeth of a sow. So they have a kind of sizzling sound when the scales are rubbed against each other. They have their particular sidewinding locomotion also. They move towards move very fast, in fact, towards the side. And the vipers have a particular strike. Actually, they strike really fast. Now, common crate, they are nocturnal, are found in fields, low scrubs, brick piles, as well as they are usually found where there is a proximity of water source. A few words about fang marks, snake bite, in fact. So snake bite, usually the fang marks or the peculiar marks of the fangs of the snake. So classically, like what we expect, there are two fangs for the snake. So classically, two puncture mark, usually separated by a distance of around 8 millimeter to 4 centimeter, depending upon the species involved. So, but the problem is that there may not be always two fang marks. There might be one fang marks. There might be multiple fang marks. The thing is that if snake uh, a side bites from the side, in fact, a side swipe may produce only a single puncture. So, and if they bite multiple times, they produce numerous fang marks. So, fang marks are not a reliable indicator of identifying a snake or identifying a snake bite event. So following following a bite, that local area, the area, there may or may not be pain. There might be bleeding from that site, and in some time there might be some swelling which develops. So you can see the fangs of different snakes over here. So you have the spectacle cobra. Now the Russell viper has really long fangs, as we discussed. The common trait is their small fangs, as well as the saw-scale viper here. So these are two fang marks. You can see two fang marks over here by a cobra bite, in fact. And here you can see four fang marks. This was also by a cobra. So as we discussed, fang marks may be multiple, single, or two. What are the symptoms of snake bite? So following a snake bite, you can develop local symptoms and systemic symptoms. Local symptoms means the symptoms which are pertain to the area of the bite, as well as systemic symptoms include the symptoms which develop in the body, like, or are pertain to the various body systems in the body. Local symptoms include, as we discussed, pain, swelling, bleeding from the site. You can see the swelling over here, which develops, and blister formation. Like, there might be a small bubble kind of blister formation over here. And also, these are very common with viper bites. So this area where the snake had bitten, as the blister was formed, following which the area is slowly turning dead. So this is called necrosis. So this area is slowly turning dead. So these are some of the local symptoms. There might also be bleeding from that site. Systemic symptoms include various symptoms because of different snakes have different symptoms. As we discussed before, viper are hemotoxic, as well as the other cobra, crate, and all those snakes are nerve toxic. So depending upon the symptoms, you have different, depending upon the different snake, you have different symptoms. You can have, because of the, so this is a man who was bitten by a cobra, and he has drooping of the eyelids over here. This is one classical sign. This is called ptosis, the drooping of the eyelid, which is classical of a neurotoxicity of a neurotoxic snake. And a viper, which this is again, his urine is shown as dark color colored or black colored urine. This is because of his kidney failure, which developed because of a viper bite. So this person who was bitten by cobra, he has drooping of eyelids. Slowly he started developing breathing difficulty, because his breathing system is also affected, and his entire muscles are slowly going into paralysis, which include his diaphragm as well, which causes breathing difficulty. Now, venom. Why is venom in the body of the snake? Usually venom is for their defense, as well as again, to find food. So the venom is used to paralyze the, some of the snakes use venom to paralyze the prey, so that they cannot move and they slowly eat them. Also for defense as well. As we discussed before, mainly the venom is either neurotoxic or hemotoxic or myotoxic. Neurotoxic means the nerve toxic, which includes a cobra, crate. The hemotoxic, which is the blood toxic, which include Russell viper and Soscale viper. Myotoxic is again which damages muscles as well as tissues, which is again predominantly the sea snakes. Dry bites. What are dry bites? Dry bites are see, what happens is, most of the bites doesn't cause venom to enter the body. Like 50% of the snake bites are dry bites. So a snake biting means, that doesn't mean that venom is always entering in your body. So these are called dry bites. Now, painless bite, very peculiar of one particular snake, that is a crate. So bite may not be always painful as well. Now, how to identify venom has entered in your body? There are, so mainly what we do is, as in the hospital or even outside, you can identify by either of these symptoms. What you can see, you can see some local symptoms which is developing, some swelling, some blister formation, or you can see that the person has some drooping of the eyelid, is slowly having altered speech, is not able to talk properly, he's having some shortness of breath. And also, once in the hospital, how to identify whether a hemotoxic venom has entered the body is by this particular test called a whole blood clotting test. In the hospital, what we do is we collect some blood sample and keep it in the test tube, keep it for 20 minutes, in fact, and then we tilt it. If it is clotted. Ideally, it should clot by the time. If it doesn't clot, that means uh, a hemotoxic venom has entered the body and is causing problems. Now, what to do in case of a snake bite? The first aids. So even now, there are a lot of misconceptions and a lot of myths about snake bites, and there are wrong practices which are being followed. So some of this stress on snake bites is because of all these wrong practices. Now, what you shouldn't do, in fact. So never panic. The thing is that, as we discussed before, 50% of the snakes only snake bites only cause a venomous is only venomous. The other 50% is dry bite, in fact. So, and of course, it can be treatable. So you shouldn't panic. Panicking, unnecessarily panicking, causes more blood circulation. You increase your BP, the more blood circulation, as well as the venom spreads faster in the body. Now, avoid any kind of faith healing or any traditional methods, or do not self-medicate. That's the first thing. Don't apply any herbs or spices. And one very important thing is that do not try to kill or capture the snake. One important thing what I would like to say is, do not try to bring the snake, kill and bring the snake to the hospital, or catch the snake live and bring to the hospital. Actually, that is not required. So snake identification, so we have only one antivenom. So if we identify that, we are not identifying the snake, we are trying to identify the symptoms of the snake bite. So there is no point in killing or capturing the snake. It can cause another bite. Do not cut or suck the bite area. Even now, some people try to squeeze out the blood, or put a cut and squeeze out the blood. What happens if you squeeze that area? The venom doesn't go out, it actually goes inside more. This thing is even now practiced. Even last week we got a snake bite. This is the tourniquet, the application of the tourniquet, or a tight thread or tight rope. Some cases we see they tie a rope so tight that no blood supply is there towards the end of the leg. So what happens? Never tie this. Never tie a rope. Never tie a cloth. So now, earlier these was practiced very much. Even now they are practiced. Never tie a tourniquet. What happens is that if you tie a tourniquet or a thread like this, the blood supply over this area will be hampered, and by the time he or she reaches the hospital, maybe these happens in peripheries of the like peripheries, for example, in Coorg or Madikeri, or somewhere in other districts. And once they reach the proper care, by the time it will be like 3 or 4 hours, and the leg will be gone by then. So again, do not apply any ice or massage the bitten area. It can again cause further damage. Now, what to do? So in case of a snake bite, immediately make arrangements to go to the hospital. So you can call an ambulance and immobilize the victim. So that is one important term to be addressed. So immobilize the victim. So never allow him to walk or move. Remove any jewelry or belt or watches or rings. What happens is the area might swell up very fast. One thing, if you seeing a snake bite mark, you can just put a small mark around that using a pen or something. That will also be good. So if the ambulance is delayed, or again there is a delay in transport with an ambulance, you can take with whichever vehicle you want to the nearest hospital. Make him lie down towards the left side. That is called a recovery position. We'll come to that. How to immobilize, we'll come again to that, and inform the doctor about the symptoms. Now, how to avoid snake bite? Close wear or close pair of shoes. Use a torch in the night. Avoid sleeping on the floor. Keep the premises clean. Now, never use things like this. Even now we have venom extractors in the Amazon or some of the shopping sites. You can see a venom extractor here. Never do this because the suction force, this is absolutely useless, not proven. Do not cut or encourage bleeding. Do not apply a tourniquet, as we discussed. There has been some cases in which they applied electric shock. Never do that. No use. Absolutely no use. Immobilization. How to immobilize? You can use a bandage, compression bandage. You can use a crepe bandage, or a little more tighter compression bandage is available. So this can be used. Particularly, this can be used for neurotoxic snake bites. That's the snake bite which causes nerve-related symptoms like drooping of the eyelids, breathing difficulty, all those things. So you have to start. If the snake bite is over here, you have to start from the tip of the foot, wind it up straight up to the groin, so to the tip, the topmost part of the leg, and you can keep a stick or some pipe or something so that so that his ankle as well as his knee is immobilized, so he doesn't move his ankle as well as his knee. Or in the upper limb or in the hand, so again you can wind it up from the tip of the hand. So how much pressure we should apply is that a little bit tight, so that this causes what happens here. The idea behind this immobilization, pressure immobilization, is that the venom spread through the lymphatic capillaries, or like blood, we also have a lymphatic supply in the body. So when we give a compression bandage over here, the flow is reduced, and at the same time, compared to the tourniquet, this doesn't cause complete stoppage of the blood supply as well. Now, question is what to do if a patient becomes unresponsive, or collapses, or if someone collapses following a snake bite. This is where your BLS practices. Some of you will be trained in BLS, so this is where your BLS practices comes into place. Would like to refresh, if for people who are trained in BLS, this is again easier. So if patient becomes unresponsive, what to do? How to recognize a cardiac arrest? So that's the first thing to do. Sometimes some snakes, like neurotoxic snakes like cobra or a crate, can cause a cardiac arrest, because if the breathing is hampered for quite some time, if breathing is not taking place properly, the heart will stop. Cardiac arrest means the heart has stopped. So how to identify a cardiac arrest? So first you have to check for responsiveness. How to check for responsiveness? You tap on the shoulders a couple of times and check whether they are responsive. If not, what to do is to call for help, that is the ambulance, activate the emergency medical services, that is the ambulances, and if available, retrieve an AED. So in snake bites, it may not be much useful, because most of the time the cardiac arrest happens because of damage in the breathing. Sometimes some snake can be directly toxic to the heart as well. So you can retrieve an AED. AED is an automated external defibrillator. I'll come to that. So then check for the pulse as well as breathing. You can check for the pulse and breathing. How to check for the pulse? The pulse, what we are meaning is the pulse or over the neck. So that is called the carotid pulse. So with 2 fingers, you can touch the most prominent part in front of the neck, and then slide to one side. In the groove, you can find the carotid pulse. So here you can check, touch for 5 to 10 seconds, and you can identify the pulse, as well as look for the breathing. How to look for breathing is see whether the chest is rising up or down. So see for the pulse, check for the pulse, as well as check for the breathing. Now, pulse and breathing is absent, we'll have to start on with chest compressions. You would have seen and you would have practiced chest compressions at some point of time. So how to give chest compressions is give 30 compressions and give 2 breaths. So that's the ratio at which you have to give. Where to give chest compressions? You have to give at the center of the chest, not left, not right. It's at the center of the chest, lower 1/3, lower half of this breastbone which you are having in front. So give compressions at the rate of 100 to 120 compressions per minute, and at a minimum depth of 5 to 6 centimeters, so approximately 2 inches, or at least 2 inches, or at least 5 centimeters. Now, following 30 compressions, then you will have to give 2 breaths as well. How to give breaths? So if you don't have any devices with you, you can give mouth-to-mouth breath. How to give mouth-to-mouth breath? Pinch the nose, seal the person's mouth with your mouth. Before that, you take a couple of breaths and then blow into the mouth of the person. You can also use these specialized devices. So once again, you give 30 compressions, 2 breaths, and you have to continue that. 30 compressions, 2 breaths. You continue till 2 minutes, and then check for the pulse and breathing once again. If not there, you continue. So you can also use specialized devices like this. These are found in most of the first aid kits. This is called a pocket mask. This can be used to give breaths. You just have to keep this on the face of the person. So this has a narrower end. This corresponds to the nose, and this corresponds to the chin. Just keep on the face, give 2 breaths. Also, you have some specialized devices. This is called a bag valve mask. Again, this has a self-inflating bag, so you don't have to blow inside, just have to press here. Some points to note, 30 compressions and 2 breaths. You know the ratio, at least 5 centimeters or 2 inches. Location is the center of the chest, lower half of the breastbone. Rate of 100 to 120 compressions. Also, you need to ensure that you need to minimize interruptions. So you have, once you start compressions, you have to continue giving compressions. You don't stop. Many a times what happens is some people try giving chest compressions. They give for like half a minute and then they stop. That's not the thing. Like, you need to go for at least 5 to 10 minutes at least. So, and then allow complete recoil. So once you compress inside, you should ensure that the hand comes out to the level to the surface, and then you go inside. So what happens, what we are trying to do is we are trying to squeeze the heart. The heart has stopped. We are trying to squeeze the heart in between 2 heart surfaces. So here we have a heart surface in front, that's the breastbone. Also we have a spine behind. So we are trying to squeeze behind 2 heart surfaces so that heart is not pumping. We are trying to pump the heart from outside. Now, earlier we had discussed to bring an AED. So AED is an automated external defibrillator. So this is used when heart hasn't stopped completely, but heart's function is heart's function is not happening properly, because what happens is the heart is usually heart pumps, but here the heart is just shivering or curing because of some problems. Some snake bite can also cause some symptoms like this. So this can be used to give shocks. This can be simply told as a shock machine. These are found in different public places. You can find one in the airports or any of the railway stations or shopping malls. Very difficult to find in the outside. So this is often found in the ambulances. The basic life support ambulances and advanced ambulances has one of these. So that's why you need to call up the ambulance earlier itself so that they bring one of these. And this is very simple to use. There are only 2 steps of using this. Our first step will be switching on. Any machine, first step is switching on. Then second step is do what it says. They have audible commands. So the AED itself give commands of how to use this. So in simple words, AED will say to attach these pads on the patient's chest, bare chest. Then AED will say to give a shock if needed. So that is what is going to happen. Now about the left, keeping the person in the left side. So what is the benefit of keeping the person over the left side? The thing is that sometimes because of some snake bites as well as some other conditions, if you keep the person face up, he or she might vomit. What happens if you vomit in the face-up position is that instead of, so what happens is that the vomitus or the matter which comes out goes inside to the windpipe. So the things which comes out through the food pipe goes inside the windpipe and causes choking, and the person's breathing will be obstructed. So that is why we need to keep them in the left lateral position, that is the recovery position. So how to keep them? So very simple. Keep their hand just below the chin and turn towards one side. The very good skill to be mastered. So keeping the person to in left lateral position. Different pictures of placing one in the left lateral position. Right. So that what happens is that if you vomit, even if you vomit, it goes outside like this. It doesn't go inside. Now, treatment of snake bite. In India, sadly, we have only one antivenom. So the common antivenom, which is effective for both all the four big four snakes, that the Russell viper, the 𝗀𝗂𝗿𝗂𝗍𝗂𝗍, the common crate, as well as the spectacle, the Indian cobra. So there are different specific antivenoms or antivenins also there in these are some of the antivenoms in Malaysia, so they are specific to different snakes. In India, the problem is the antivenom production. So the number of snake bites and snake bite envenomations are huge, and the antivenom production, we are not able to meet the antivenom production. So that is why we don't have specific antivenoms. And your traditional antivenom production, how do the venom is extracted? Animal is injected with that, and the blood is collected. The antibodies are purified, and there is the antivenom of the snake. Is there any complications of antivenoms? Antivenoms, the problem is that this is mainly made out of animal immunization. So there are high chance of allergic reactions. So that is the main risk of using an antivenom. But there is only one treatment, that is anti-snake bite venom. Even if there is allergic reaction, what we do is we wait for some time and then we restart. So one important thing is that even if you encounter a person with a snake bite, take them to a facility or a hospital which is capable of, or which has this antivenom facility. Otherwise, it's useless and it's a waste of time. Now, a new development we are proud that the Indian Institute of Science, Bangalore, they have developed a synthetic antibody which neutralizes other deadly snakes, which include other snakes as a king cobra, black mamba, and all. So the benefit is that it's a synthetic antibody. They have developed it similar to the COVID and COVID vaccine. So the benefit is that the allergic reactions won't be there. And we are actually one step closer to the universal antivenom. So far we have seen the various first aid, some skills of which can be used in case of snake bite. So finally summarizing, so never use a tourniquet or apply ice. Do it right. So R4, reassure and remove any constricting jewelry. Immobilize the limb, the hand or the leg. Get to the nearest hospital, so GH, and tell the doctor about systemic symptoms which develop on the way to the hospital. So that is with thank you. So we are one word about outdoor medics. We are basically into outdoor first aid as well as outdoor basic life support training. We run various courses. Some of our courses include an austere or wilderness first aid, first responder, some basic life support, as well as austere basic life support courses. References and questions.
So thank you so much, sir. It was indeed a great session, and thank you so much for your valuable knowledge. And now the session open for discussion. If anybody has any doubt, you can ask the speaker or ask in the chat box.